Hi, my name is Angie Voight, and I'm a sports medicine doctor at Summit Orthopedics, and I work with a lot of runners, and I am a runner as well. So I wanted to give 5 tips for what not to do for runners. One of the main things that I see, one of the common things, is that people who, especially when they start running, they increase too quickly with their mileage. So if you haven't been training that much and then all of a sudden you have a significant increase in how much you do, it's the number one reason I see injuries. So in general, trying to be slow with your increase, which could mean increase your mileage by 10% a week, is a really good general rule for how much to increase, and it really does help decrease your injury risk. Number 2 thing that I see is if people don't do strength training, they don't do their physical therapy, especially runners, a lot of times you just like to run, and so you're trying to spend all your time running and not doing your physical therapy, not doing any strengthening or cross training, and that is a really big risk for injury. So especially if you've had anything lingering, like if you had hamstring issues or glute or Achilles or plantar fasciitis, knee issues, those are things that I commonly see, and if you just try to keep running through them and don't address them with a physical therapist, it'll really derail your training and make it hard to keep going. The third thing that I see is a lot of times people will sign up for a race, especially a longer race like a marathon, a half marathon, and you really don't give yourself enough time to do the training. For example, for a marathon, if you only have 3 months, it's really not enough time to build up your mileage to the point that you need to be able to complete a longer race. So I think, and even for shorter races, even for a 5K, giving yourself a lot of time to build up and to be prepared. And then you're able to slowly increase your mileage, and you don't have to do the big jumps that can increase your injury risk. The fourth thing that I see is a lot of times, with running, it's hard to stay motivated. It's hard to keep doing the training that you need to do. It's really helpful if you have a group, if you have people to keep you accountable. If you're meeting people, it's a lot easier to get out and get up early, get that run in, do your strength training. And then the last thing that I see is a lot of times people have equipment that is not adequate for the type of training that you're doing. So a lot of times for runners, it means, running shoes that have too many miles on them, running on an inappropriate surface. In general, I recommend that you change your running shoes every 300 to 400 miles. A lot of times you can go a little bit longer, but you really start to feel a difference in your joints. You get breakdown of the shoes, and so that is the max that I will do on a pair of shoes, is 300 to 400 miles. And then the training surface matters too. A lot of times if people are used to training on a treadmill, which is a softer surface, and then they run outside on a harder surface, that will increase your injury risk as well. So those are some of the things that I commonly will talk to runners about. If you have injuries or issues that you want to have addressed, I'm happy to get things checked out at Summit. We have physical therapists who work with a lot of runners. They can give you some great strengthening things to do, some really good tips to keep yourself healthy and running and training.